All right, let's go over some practice questions and some testing your knowledge in regards to growth and development within pediatrics. So, a lot of these, like I said, are just to test your knowledge. You're not going to be asked specifically on the various theories of growth and development on the NCLEX, but it's good to recognize them and be familiar with them. As always, pause the video after we go over the question and the answer options, or just go over the question. That way you can come to the correct answer independently, and then you can resume it so we can discuss the rationale together. All right, so a nurse, this is a classic multiple choice, select all that apply, physiological integrity. A nurse is providing education on Freud's psychosexual stages of development. Which of the following would the nurse include in her teaching? Select all that apply. So this includes, this requires you to have the knowledge of Freud's psychosexual stages. So I want you to go through and determine which of these statements are true or accurate. All right, little bit of a trick question, but they are all true or accurate. So Freud's psychosexual stages of development include an oral stage, which is birth to 18 months, an anal stage, which is 18 months to 3 years, a phallic stage, 3 to 6 years, latency stage, 6 to 12 years, and a genital stage, which is puberty to adulthood. Of course, each stage is characterized by a conflict that must be resolved before the individual can move on to the next stage. Multiple response, select all that apply, physiological integrity. A 6-month-old infant is brought to the clinic for a routine checkup. The nurse is observing the infant play and interact on the play mat. Which of the following skills would the nurse expect to observe? Select all that apply. Now, this is very important to know for the NCLEX. Know your infant and toddler skills and what milestones should be reached by what age. So you have a 6-month-old infant. What behaviors would the nurse expect to observe in a 6-month-old infant? All right, so the nurse would expect the infant to be able to roll from front to back, grasping and holding on to small objects, and responding to their name. So at 6 months of age, an infant is typically able to roll from back to front, hold those small objects, and respond to their name. Walking with assistance, feeding oneself with a spoon, and using a pincer grasp to pick up small objects are not typically seen until later in development. While it's always important to monitor a child's developmental progress, it's also important to remember that each child develops at their own pace, and some deviations from those expected milestones may not necessarily indicate a problem. Matrix multiple choice, physiological integrity. So the nurse is providing education to a new mother on developmental characteristics and expected milestones of a child as they grow. So I want you to read these mother's statements, indicate if they are true or demonstrate an understanding of the teaching, or indicate if they are false, inaccurate, demonstrate a lack of understanding of the teaching. All right, so you can expect the child to have their first tooth by 6 to 12 months of age. You can introduce solid foods at 6 months of age. And potty training usually occurs around 3 months of age. It's very important when you're introducing solid foods, you want to introduce one new food at a time, and you want to only do that every 4 to 5 days because you can determine the presence of food allergens. Classic multiple choice, physiological integrity. The pediatric nurse is observing a 3-year-old patient in the waiting room of an outpatient clinic. When recalling Erikson's psychosocial development theory, the nurse is able to identify which of the following is the primary developmental task of a 3-year-old. So 3 years old, Erikson's psychosocial development theory. So which stage would that 3-year-old be in right now? The correct answer is initiative versus guilt. So, according to Erickson's psychosocial development theory, the primary developmental task of a 3-year-old is to develop a sense of initiative versus guilt. During this stage, children develop a sense of purpose and the ability to initiate activities, but they also may experience some guilt or anxiety if their actions are deemed wrong or improper. Trust versus mistrust is developed in the first year of life. Autonomy versus shame and doubt is primarily in the second year of life. And then industry versus inferiority develops in middle childhood. All right, this is just a test your knowledge. So, arrange the following food groups into the accurate order for introduction to a child at 6 months of age. So, your baby is 6 months old, you can introduce solid foods. So, in what order are you going to introduce these foods? All right, so you should introduce iron fortified rice or cereals initially, followed by fruits, then vegetables, then meats. So the important thing to remember is it's one food at a time every 4 to 5 days to determine the presence of allergies. And then also remember that eggs are not introduced until 12 months of age. This is primarily due to the risk for salmonella if an egg is undercooked.